This episode of Straight Outta Health IT is brought to you by Welling, your trusted partner connecting healthcare organizations, data, and innovation for a healthier community. Welling helps healthcare providers navigate complex challenges, from analytics and AI to workforce solutions and community health impact. Because at Welling, we believe when healthcare is connected, everyone thrives. Learn more at wellinkcommunity.com.
Straight Outta Health IT, the mic stays surgical. Christopher Kunney moves vertical, purposeful. Strategist with the vision, breaking every system's cage. Guests unfiltered, flipping chapters every page. Industry talk raw, no sugar, no varnish. From policies to tech, the convo ain't tarnished. Blueprints unfold, the future in the dialogue. Cutting through the static sharp like a monologue. Change makers in the building.
Hi, we're back, and I have as my first guest Eugene, the founder of Advocaid. He is the founder CEO of a platform that's focused on diabetic monitoring. And I wanted to chat with him today to get his impression on why he's at this event, why does he think it's important, tell us a little bit about the technology solution he's bringing to market, and why the patient is important to be in the center of this. So I'm going to turn it over to you first, Eugene. Tell us a little bit about you, your journey, your story. What was the motivation for starting Advocaid, and a little bit about the platform itself.
Thank you. Thanks, Chris. So we started out several years ago because there was a need in the Texas healthcare market.
Right.
And that's where we're focused on, is Texas Medicaid diabetic population. So we were serving that. Another company that I'm also chief operating officer of is Veritas Health Services.
Sure.
And we saw a lot of patients, saw a lot of need, and we couldn't find anything on the market that would serve that need in terms of managing the whole cycle of diabetic supplies.
Exactly.
From the glucometers to strips to lancing devices and lancets. So we set out to set up a company to make the hardware.
Sure.
And then also the software to support it.
Wonderful. So I take it there is a supply chain challenge for patients who are managing their diabetic.
Absolutely.
Access to their...
Yeah. Unfortunately, in Texas Medicaid does not cover supplies for diabetics. Okay. So there is no way for them to get diabetic strips, right, lancet devices, alcohol pads, or anything else that they need for their needs that's covered by Medicaid. Okay. Right? The only exception is continuous glucose monitoring, but only very few people qualify for that program. So the vast majority, they just have to provide the supplies on their own. And as you would expect, most don't.
Sure. Wonderful. And so what brought you today to this event?
Well, we want to spread the word of the availability of this program. So the Texas Medicaid program supports remote patient monitoring, and under that umbrella, there is a way to cover the supplies. There is a way to cover the monitoring. It's a fantastic program, the most progressive program in the whole country. There's no other state that has it. We have the best RPM program, remote patient monitoring, in the whole country. The main reason for that is that the state has split the payment system, where the physician is getting their professional fee. And then us as a supplier of the technology and the supervisory role, we get paid separately. Okay. So the money is split up, goes into two different buckets. Okay. There is no conflicts of interest. Right. And then we're able to provide all of the services and the supplies fully funded by the state funds.
Sure.
No cost to the patient.
Okay.
And then there is no cost to the providers to work with us.
Oh, perfect. So I love that. Yeah, that's great. So as we get kicked off today with this specific event, what are you hoping to gain from some of the thought leadership that is going to be presented here today? And if you could lead the listeners with kind of one thing to consider as they think about your company, especially how did they reach you, what would that be?
Sure. So what I really wanted to know is all the conversations about the patient journey and how artificial intelligence is helping that. Okay. So with the agentic AI models that are out there, maybe automating some of the patient engagement or reacting to alerts. So alert fatigue is a real thing. Absolutely. In the physician space. And I'm looking for some guidance on how to improve maybe our own technology to support that. And then you can reach us at advocaid.com. And then for our healthcare services providers, there's veritashs.org.
Wonderful. First of all, thank you so much for your service. It's something that's desperately needed for this growing population of patients who are dealing with this chronic disease. We appreciate all you're doing and look forward to seeing great things beyond Texas as well, too. For those of us who don't live here and need the same technology in Georgia and other places as well. So we hope that you'll...
We definitely have plans to expand. Yeah. So we want patients to get more of these in their hands.
Before we wrap up, tell us what this is.
Yeah, so this is the monitor itself. It's a 2-in-1. It's a blood pressure and then blood sugars on top. We manufacture the strips also. And it has a built-in cell phone on the AT&T network. So all the patients needs is this. So even our patients in East and West Texas, they're not very well populated. They're able to just press the button and submit the readings, and the doctors get them immediately, and then proceed with any changes to the plan of care that are necessary.
Wonderful.
Very easy system to use.
Absolutely. And that's the beauty about it. It's powerful, but simple for patients to use as well, too. So we definitely look to see great things out of your company. It's great for coming on Straight Outta Health IT and talking about it. Appreciate it, Garth. Have a great day.
Thank you.
Thank you. Okay, we're back again, and I have as my guest Jeffrey Enon Jalil.
You see, I was going to let you stumble or succeed, and you just succeeded. Yeah, Keenan Jalil. That's the one. That's the one. Mm-hmm.
He is with Hunt AI, and he is the founder and actually CEO of the company itself. And he's here at the symposium today to share his thought leadership, talk about his platform that he's brought to market, and tell us why we should be using Spin Analytics platform to support patients' better outcomes. So I'm going to tee that up for him and let him tell the whole story, and tell us a little bit about your journey too. How did you get into this space, and why is this important to you?
Well, the big thing for me, really, plain and simple, I lost my brother to cancer in 2018. Yeah. I was one of these corporate jockeys that was riding, let's say, the ride of, executive position from one place to another.
Exactly.
And then I decided to say, hey, I want to actually bring something back to healthcare.
There would be a conscientious capitalist, right?
Well, enough of the capitalist side, all right? I'm not definitely done. I'm not going to get into that Republican Democrat sort of discussion. Definitely not on a podcast.
Although it might be interesting.
But the harsh reality around what we actually have done is we want to provide complete price transparency into the healthcare sector. It's massive. When you've got a $3 trillion organization that's actually churning at 5 to 6% growth year on year, and then, how much of that money is actually being, let's say, pumped back into patient experience, patient innovation. My view is I want to make sure that every dollar that can be brought back, recovered, is given back to the hospital systems.
Makes sense. And so why is that important to the patient?
At the end of the day, there's nothing else but trying to use enough money to actually have that reach to get to all of these people that can't afford healthcare.
Exactly.
The net result as well, when you think about healthcare in general, where's the innovation going to come from? Dare I say, we hate to actually think of hospitals as actually being a revenue source.
Right.
The reality is it's a cost base.
Absolutely.
And from a cost-based perspective, what are we trying to do? We want to actually maximize the output, minimize the cost.
That's right.
So then we can actually reach the patients more exclusively.
That makes perfect sense.
Yeah.
And as many hospital executives say, no money, no mission, right? And so we've got to figure out in this day and time where the cost is rising, what is it, 18, almost 19% of GDP now and growing. Mm-hmm. If we don't get our arms around the cost controls associated with healthcare, it's going to be unsustainable.
Well, I'll ask you a question. Chris, do you really think that we've actually got a hold of healthcare costs today? Because the reason why I brought this company and this platform together, and we're talking about Spend Analytics, plain and simple, there's legacy technology that's actually been counting the dollars over time.
Absolutely.
So now if you're using artificial intelligence to read every invoice transaction at the detailed level so that you can provide transparency to know what one supplier is charging another supplier or what one GPO is meant to be providing you in admin costs back to you, then how are you trying to do this? Let me give you a classic example. So if you had let's say a hospital system that was churning out a revenue of, let's say, $3 billion, they'd have a cost base of around about $1 billion.
Right.
They would actually typically be running around about 200,000 invoices a year.
Okay.
200,000. But the number of transactions, close to 1 million transactions a year.
Wow.
Now, what my platform does, to actually start to compare any of those invoice and transactions, you're running about 20 billion records.
Is that right?
So you as an individual, as a
possible, we could process that.
Human. Some people come up to me and say, well, we got this process under control, and said, so you really, Because, AI, as much as it's been around, we've been around for 6 years now. We've been developing this domain-specific our language model that's focused purely on finance transformation dollars.
Absolutely.
You just can't pick that up just like this.
And I think the beauty, and correct me if I'm wrong, but I think I've hit the mark on this as well, too. You're not only aggregating this information and being able to serve up really deep, intelligent data, you're being able to do it almost real time.
Near real time. Absolutely, 100%.
And the power of that versus what we have traditionally done in healthcare, which could be months, sometimes years of getting these insights, is transformational.
100%. But let's not take anything away from the industry sector today, because, when we're talking in the clinical setting, there's a lot of powerful AI, there's a lot of powerful clinical data transformation and insights. But let me just ask a question. When you're talking about financial data inside a hospital system, for every dollar that's actually spent, for every invoice that's actually been transacted, every supplier is naming their product differently.
That's right.
Every organization is then having a natural language, let's say free flow text in their item and how they actually describe it. So how do you compare that from one hospital system to another? And let's say you're a hospital system that's now bought one hospital, 2 hospitals, 15 hospitals across multiple ERPs. How can you bring all that information together?
So effectively, the way we've normally done it, right? So here's where spend comes into play, right?
Well, for every dollar saved, goes back into patient care. And the reality is, we just, completed a analysis on one GPO. This GPO, from that perspective, we found that there was an uplift of up to 25% of the admin fees due to the member.
Well, it's interesting you bring that up. One of the questions I was going to ask you as you were talking to the platform is, how does this compete with what the GPOs offer? Does it augment what they offer? Does it hold them in check? Help me understand a little bit more about how does this impact the whole GPO model of the health?
Chris, you're prompting a lot of serious questions, and is a yes and a yes and a yes. Okay. Because, ultimately, who actually wants to take advantage of this?
Right.
The reality is, if a GPO understands that they have actually, let's say, been miscalculating what has actually been spent by their members, and then going out to the supplier to actually then get the rebate that they can redistribute as admin fees back to the systems. Okay. The reality is, the more that they can actually capture and go back to the supplier, then the more of a GPO actually brings in value. Okay. Second component with regards to that is, yes, is the GPO really giving you the right administration fee back that actually is associated with your base sales, associated with everything that you purchased?
Exactly.
There are thousands, tens of thousands of products, tens of thousands of GPO contracts that are out there. And then how do you align that in a multi-tiered system, supplier, GPO, across multiple systems and hospitals across the country, and then zillions of products.
Sure, and do that compare and contrast amongst all those products.
Yeah, and then say, hey, Mr. Hospital System, I've literally understood exactly what you purchased.
That's right.
So there's a lot of disconnect, because even within the hospital system, how do they truly actually understand every invoice that they've actually paid is correctly being paid? So what do they typically do? They bring in finance transparency companies. They literally do spot audits associated with this. For what we do on our platform.
Snapshot, right?
Snapshot, episodic.
Exactly.
Episodic. So like you said it right at the very beginning, right? 2 years, 1 year, 3 years. Speaking to a hospital system at the SMI conference just last week in Orlando, they just completed their spot audit 2 years ago.
Right.
Long time, 2 years. Lots happened in 2 years. But once again, spot audit. Did they do every transaction? Did they do every line item? Did they capture every dollar that was actually due to them? The answer would be categorically no. And that's also the same with regards to the invoices. Invoices that are actually there as well. Are you capturing every invoice? Do you know that you haven't actually had duplicate invoice payments? There are finance transaction firms that are, let's say, monitoring and managing that on an episodic engagement perspective. But we go back for the last 5 years and monitor every item within the invoice to actually make sure that there's no duplicate invoices in there.
I got to stop you right now, because I could sit here and talk the next hour.
I want to.
But you know what? I got to let you get back out there and talk to the rest of these.
Absolutely.
Here, tell them that story. So if someone wanted, and that's listening to this episode, wanted to find out more about what you guys do, what's the best way for them to get in contact?
best way is just to go to our website, hunterai.com.
Simple. I like it.
Love it. Thank you. Thank you.
We're back, and I have to my right again, Matali Paul. She is the administrator for the Department of Surgery at Houston Methodist. She also serves as a board member for the Southeast Texas chapter for ACHE, and she is also present here in support of it. ACHE is one of the supporters of this event this year, and I asked her to come in, talk to us a little bit about her focus around the patient experience, why ACHE, the local chapter, decided to support this event, and what she's hoping to get out of it as well.
All right.
Is that fair?
Yeah.
All right.
Absolutely.
Let's jump right into it.
Put me on the spot.
Let's go ahead. You're on the spot. Camera's on you.
So, obviously in healthcare, we all get into healthcare as leaders, as administrators, as clinicians to take care of patients.
Yes.
And a patient is truly at the center of everything that we do. I'm very fortunate to be a part of an organization like Houston Methodist, where we do have a very patient-centered approach in what we do. And, had the opportunity of working with Josh when he was at Houston Methodist. Even in my current role now, everything that we design and plan and work around is what's best for the patient experience, what's best for our patient outcomes. As a Department of Surgery nationally, we have some of the lowest mortality in the country.
Congratulations.
Some of the best quality metrics that we have. And obviously that kind of represents how everything that we do is with the patient in mind.
Exactly.
To make sure we're giving them the best care, using the best innovation and technologies possible to take care of them. So my interest, or ACHE's interest in this symposium, was one, that it was the first of its kind.
Exactly.
And we're always here to support the healthcare ecosystem.
Yes.
Thank you. I was looking for that word. In the TMC, in the greater Houston area. We work very closely with the other professional organizations like HFMA and NACI or HIMSS.
Okay, part of all of those.
Yeah. And so I think ACHE has always been a very welcoming organization and have had the opportunity of serving on the board for the local chapter for the past couple of years. And when Josh reached out to me and said, would the chapter be interested in supporting this? I said, absolutely. I mean, all of us in healthcare are here for our patients. And so,
community.
Yeah, very excited to see what the day or what the afternoon has in store. Looking forward to listening to some great speakers and taking
I think you have some folks from your organization.
Yes, we do. We do. So, yeah, excited. And of course, I'm here to support Houston Methodist as well.
Exactly.
So I'm wearing both hats.
Sounds good. Well, we're excited. First of all, thank you so much for being a leader in this space. We're definitely looking forward to hearing from your leadership and the best practices and approaches that they're taking to help improve the patient experience and improve their journey to quality of care. And then thank you from an ACHE perspective in supporting this first of its kind. Hopefully not to be the only one, but we'll see this as a seed that's planted, and we'll take this hopefully around the country as well too. And just thank you for being a leader in this space and supporting the families who come to your organization, Houston Methodist, in a time where they're most vulnerable.
Yes.
And to be able to be sensitive to that and support them in their patient journeys as well. We do appreciate that.
Yeah. Providing compassionate care, culturally competent care.
Absolutely.
And the highest quality care. I mean, that's what keeps us leading medicine.
Absolutely.
So that's definitely something that, we do. And even as a premier professional organization, ACHE has kind of the similar mission. It's of holding our leaders to the highest accountability in what we do as healthcare executives.
Exactly.
Right? So, yeah, it's great to be a part of both.
Wonderful. Well, we appreciate your leadership, at, the provider level, at the association level, and at the community level at a whole as well. So enjoy the rest of the symposium today.
Right.
But I'd love to get your feedback afterwards, as well, too, on all the different social media channels that we'll be promoting this event on. And hopefully next year we'll see you on the panel as well, too.
All right. We'd love to be a part of it.
Sounds great.
Thank you so much for chatting with me.
Thank you for your time.
All right.
All right. Take care. Hello, everyone. This is Christopher. I'm back. I had Edie with me, who has just got off the panel discussion with me as a moderator here at the summit. And I asked her to come over and spend a few minutes talking to you about what she does at her organization and her just general comments about the work they're doing to support the patient experience. So, Edie, welcome.
Thank you, Chris.
Introduce yourself to our what I call my tribe. Our tribe in terms of your background, a little bit about your journey, and then your role at your organization.
Yeah, absolutely. Hi, guys. I'm Eni Kiko Thomas. I am here in Houston, Texas. I work at Memorial Hermann Hospital System. I'm one of our VPs in IT, and I also help to oversee the Memorial Hermann Innovation Hub. I've been in health IT for the last 20 years. I started my career off on the payer side of the industry, worked around the country, even traveled to China a few times, really deploying large-scale software implementations, and ended up at Memorial Hermann in Houston, Texas over a decade ago. And since then, just been really in the throes of what does it really look like to deliver emerging tech in the healthcare space, really supporting our consumers, patients, providers, and how do we really start to innovate as a healthcare system leveraging technology.
Wonderful. Well, congratulations on the success as a innovator and leader in this space. And I'm excited to hear that Memorial Hermann is making a commitment to innovation by establishing an innovation center and helping to cultivate the next generation of technologies. I know personally, I've been talking about for well over a decade, the health systems need to take charge of the development of their own innovation and not just leave it to vendors, but to partner with them, in some cases, build it themselves as well, too. We talk about a number of things on our panel discussion around patient experience. And I asked, a question about some of the pitfalls associated with it internally in the organization. But I just want to turn the question around because I'm sure you talk to a lot of startups and emerging tech companies and you're evaluating them. What are some of the common challenges and the issues that you have seen many emerging tech companies or startups make as they try to implement technologies to healthcare space?
Yeah, healthcare is a very regulated industry. And so from a startup perspective, really wanting to work with an organization the size of Memorial Hermann comes with a lot of process that they need to be prepared of. How do you go through vendor vetting? How do you validate your compliance, your risk, working with privacy, all the various or cybersecurity, healthcare data? Nobody wants to have a cybersecurity breach. So it is very regulated in the process of how you are able to get startups or small vendors through a very large system requires time and diligence and a lot of investment. And some startups are not just prepared for that. They haven't really gotten some of those structures organizationally within their companies ready to go to be able to work efficiently and effectively and or with that speed that we would want to from an innovations perspective, partnering with a large organization. But Memorial Hermann is really committed to wanting to validate that we get to support a lot of entrepreneurs, our internal entrepreneurs or entrepreneurs coming out from a health tech perspective. So even though some organizations may not be ready, we do provide a lot of coaching and mentoring to say, what would it look like for you to be able to come into working with a large hospital system? What are some of the things they would need to hardwire within their platforms or just from an organizational perspective overall?
I love it. You said something on the panel right as we were wrapping up. We're asking, to kind of give your final thoughts. And you said you need to ask yourself, what's the problem you're trying to solve, right? Mm-hmm. As you look at implementing or deploying innovation. Talk to us a little bit about that as well, too, and expand a little bit, because we just didn't have enough time to really expand it on the panel and stuff. But talk to us from that perspective, but also from the entrepreneur perspective, because I advise a number of startups and emerging tech companies. And in many cases, I have found that you've got founders who are trying to implement technologies based on their view of healthcare versus what healthcare says is the real issues and challenges. Yeah. So I'm just curious from your perspective on that.
There is a lot of vendors out there, a lot of vendors that sometimes it appears that you have the next shiny toy.
Yes.
So I think it's very important for us as a system, as an organization, to work with our operators, clinical leaders, system leaders, to really say, what is the problem organizationally that we are trying to solve, and think about technology last. Right. Do we have a really clear problem statement? Is this an internal problem, clinician burnout, Is this a consumer experience problem? How can we connect to our consumers or patients more effectively? How can we create more access? There is no limit of problems that we're trying to solve. There's also, based on the problem you're trying to solve, probably better vendors that align to our problems. So often for us to be able to start to eliminate the noise, it's really important that we anchor ourselves and everyone knows kind of like what's that North Star.
Sure.
And based on that is where we really want to anchor to the problem. After we know the problems, then we can start to say, is this capabilities we have internally? Do we already have a vendor solution that we could leverage for this? Or is this something we want to go to market for?
I love it. I love it. And as we wrap up this conversation, and by the way, she's coming back on my podcast to do a much longer interview as well, too. So stay tuned for that. But as we wrap up this conversation today, just one simple question. Why are you here? What brought you here today?
Yeah, I am passionate about healthcare. I'm passionate about the business of healthcare, passionate about how we could truly leverage technology to change the way that we care for patients and our community. And I love to be in a space where we have a lot of like-minded innovators that are really passionate about how can we go about solving the problems that are before us in healthcare differently. So when I'm invited to these spaces, I love to come. I love to meet new industry partners. I love to meet new friends in the industry, love to learn. I think there's a lot of opportunity in how do we go about leveraging technology in healthcare? How can we do it more effectively and efficiently? So there's no better spaces to be in than some of these conversations.
Wonderful. Well, we're going to leave it at that. Thank you so much, E, for taking time to have the conversations with us.
Nice meeting you guys.
Nice to meet you as well. Look forward to having you back on.
Absolutely.
And enjoy the rest of the symposium. Hello, everyone. This is Christopher Kunney, and I am in Houston, Texas. I have been given the honor and privilege to host Straight Outta Health IT at the Patient at the Center Symposium, sponsored by these three wonderful individuals who are the brainchild behind this event. I think they're getting ready to revolutionize how we provide thought leadership in this space. So I'm going to let each of them introduce themselves, and we're just going to have a quick chat about why did they decide to do an event like this, and what can we expect from the upcoming speakers and presenters and thought leaders who will be here today. I'm going to start with ladies first.
Thank you. It's a pleasure to be here. I'm Brittany Jones. I'm Vice President of Sales and Partnerships at GoZio Health, one of the sponsors.
Thank you, Brittany.
Awesome. Vernon Samuel, Director of Sales at GoZio.
Wonderful. Josh.
And I'm Josh Soul, Managing Director at FTI Consulting.
Wonderful. Well, thank you. This is the brainchild right here behind this event. So just a simple question I'm going to ask each of you. Why did you decide to do this event? I mean, something that, you know, as we were playing this over the past couple of months or so, you thought was going to be just a handful of folks that'll show up. It's standing room only that's playing today. So we're just excited about what's happening. And I want to start in ladies first. Now, what brought you to decide to do something like this, such an innovative approach?
You know, we really wanted to come into a local market. I mean, we all just came back from health, massive event, lots of stuff going on. But what I feel like some of these bigger events are missing is true thought leadership and connection with people in the community that are really trying to change the way that healthcare is delivered. And Houston is a great place to look at this. So we've got some great thought leaders, speakers, panelists to really talk about how they're trying to change the way that healthcare is delivered. So yeah, very excited about the event.
Love it. Love it. Gentlemen, you want to jump in? Sure.
Yeah. I mean, I think when we look at healthcare as a whole and some of the challenges that exist on the patient side is how do you keep patients tethered to the health system? And in order for us to help solve that problem, we need to have the right thought leadership. Let's stay connected. Let's have the right folks from an IT perspective come up and stay creative and thinking of these ways on how do we continue to advance and driving the right outcomes and delivering the right message, keeping those patients tethered to the health system. But we do that together with the right thought leadership from a healthcare perspective.
Absolutely.
I love it. Yeah. So from our perspective, we're taking the Houston market, adding providers and IT folks together in the same room.
Absolutely.
That's where the magic happens. If you can translate IT to support superior clinical and business operations, that's what's going to be a game changer in a healthcare system. So by bringing those groups together, we have the National Association of Latino Healthcare Executives. We've got HIMSS Houston chapter. And we've got the ACHE Southeast Texas chapter all together on our one roof
supporting this event.
Exactly.
When all of that comes together, now we're really talking about how we can improve a patient experience.
How about a collaborative effort? It takes community, right? And I think the beauty about what I was so excited about this particular event was it's focused on the patient, right? The purpose of why we're all in this industry at the end of the day. So I'm so excited about hearing from the different thought leaders about what they're doing to focus on providing better care to the patient, hearing the patient's perspective, understanding the patient's journey and challenges, and how we envision the future of the patient and healthcare going forward. So lock in, people. We're about to get started. You'll start to see other thought leaders will bring to the session to talk about what they envision for the journey of the patient. And we appreciate your support as well. Please, thank you.
Thank you.
Straight Outta Health IT, where the talk stay free. Tune in, turn up. This is where you want to be. Data-driven dreams, they decode the code. Hack the status quo, make the old ways implode. Gus dropping gems like pockets of gold mines. Healthcare's front lines, redesigned in real time. Kunney got the mic, architect of the chatter. Revolutions in the air, healthcare's new chapter. From telehealth to equity, nothing stays unseen. This is more than a podcast, it's the dream machine. The system's pulse is beating to the sound. Voices of change.